Good afternoon, everyone. Welcome to today's webinar, Learning from the Landscape, Strategies in Early Childhood Health Equity. I'm Kirsten Klatka, and I'm a Senior Project Manager based at the National Institute for Children's Health Quality, otherwise known as NICHQ, and I'm also a co-project director on the Early Childhood Health Equity Landscape Project, which we will be discussing today. So we hope that after today's webinar, participants will be able to identify other early childhood health equity initiatives for networking and potential shared learning and successes and challenges, as well as be able to describe some key strategies and successes that some other initiatives have found to be impactful to them in their work. So this project is funded by the Robert Wood Johnson Foundation, and the organizations Child Trends and NICHQ have closely collaborated in this work through an equal partnership. So our agenda for today will start with an overview of our project team, and then we'll hear about the landscape project itself, followed by some bright spots from 3 early childhood health equity initiatives. And then we will wrap up for the last few minutes with some discussion and Q&A, and feel free to put your questions in the Q&A feature at the bottom of the screen as we go. And now I'm going to hand it over to Catherine Tout, our principal investigator based at Child Trends.
Good afternoon, everyone. So nice that you've joined us today. You can see our project team here on this slide. We have staff both at NICHQ and at Child Trends in offices across the nation. And in true COVID form, this team has never met in person. We have only met virtually. So we're really delighted that you've joined us today. I'm going to take a little bit of time to just provide a backdrop for our project and give you some information about the work that we conducted, some of the resources that we've produced from the project, but really the bulk of our time today is going to be spent hearing from some initiatives. So all of this background information I'm sharing can be brought to life. We know that across the United States, local communities and regions have recognized the urgent need to support the health and developmental well-being of young children and their families by coordinating activities and building stronger systems. Early childhood health equity work, as we've defined it for this project, seeks to strengthen early childhood systems in order to support healthy child development and reduce health inequities and disparities that can have a lifelong impact. So to give you a picture of what these initiatives look like across the nation, I've highlighted a few of the key features. First and foremost, they respond to the evidence documenting what children need to thrive. These initiatives are based in science. They're based in the research about the context and the conditions that support children and their families. In addition to the scientific data and the national data, these are also based in community data. These initiatives were developed to address community level data that shows them the disparities in access to resources that result from systemic racism and other barriers to well-being. So these initiatives are very squarely based in the conditions of the communities in which they're located. A really important feature of these initiatives is that they attempt to address this intersecting circles of areas of children's health and well-being and the contexts that provide support for children. So they operate at the intersections of services and policies to not only support health or not just support high quality early care and education or strong families, they support all 3 of these pieces together. And finally, they also include collaborations across sectors and funding streams. So that's another really important feature of these initiatives, that they do this to meet the needs of children and families in the context of their community. So these really are efforts to bring together collaborations of sectors to address a multitude of issues. So So our goal with this project was to better understand these initiatives. Now, you may have an initiative in your mind that you're thinking of, and what we know is that these initiatives vary quite a bit across communities. And when you take a look at some of our project tools that are available, our landscape map, our initiative explorer, you'll see that there really are a variety of initiatives there. They share these common features, but the details of the work they do can be really individualized. So to find and understand the initiatives, we conducted a survey and we found initiatives through a variety of methods. We used Google searches, but we also relied on professional contacts and asking for nominations. We included nomination forms and survey links in a variety of listservs that went out to initiatives. So there were a variety of ways that we attempted to find initiatives. We know they are incomplete. There are many initiatives that likely did not get our email or did not get nominated. And we are really eager to continue building this database of initiatives over time so that we can continue to map and understand the wide variety of initiatives that are occurring across the country. So we did this initiative survey, and from that we produced a map. I'll show you some screenshots of that in just a minute. It's a map, but it really is actually an explorer tool that allows you to look at different features of initiatives, select those features, select particular geographic areas, and dig deeper into where those initiatives are. And then to learn more about, more in depth from the initiatives, we also conducted a series of virtual conversations. So these were intended originally to be in-person conversations. They switched to virtual conversations last year, and we were able to go in depth on the topics you see listed here: operationalizing equity, measuring and reporting on progress, sustainability and finance, cross-sector collaborations, and state and local partnerships. You can go to the next slide. This is just you can see these briefs, the two-dimensional version here. We have a variety of these tools available on the website that I shared earlier. But what I can say about this is that these are really intended to bring you the voice of these initiatives. These are not evaluations. They're not systematic evaluations of these topics, but they're really a way for us to highlight the importance of each of these features and to provide some initial hypothesis generating statements about the strategies that were successful, about the experiences of the initiatives with each of these topics. But we know this really is just scratching the surface. There's much more in-depth work we could do, but if you do take a look at these, you'll find many, many examples from initiatives across the nation that relate to each of these topics. We also have 3 case stories that will be coming out shortly. They're not available yet, but that will be even further in-depth information about particular locations. So now moving to our map, I'll just give you a very brief overview of this. You'll want to play around with it on your own, but this tool is available. When you arrive at the page, you'll see this map and you see the orange square, the orange circles, which are the local initiatives. And then each of the stars in the states represents a dot that you can go to learn at the state level. Now, of course, one of the things we learned right away or wanted to explore further is that interesting and important connection between the state level efforts and the local efforts. And we also know that there are many networks, there are collaborations, there are convenings and supports for these initiatives that attempt to bring them together. So you'll see some of those organizations and networks and supports in our briefs. We know they're playing a really critical role in bringing technical assistance and capacity building to initiatives, but we also know there are many initiatives there that haven't yet been part of those networks. There are many that are still not connected to other networks. So we hope that this map is a good way to start providing that networking opportunity. And the next slide, you can see the second part of this. This actually shows you how you can zoom in on the map to a particular state or a particular location, and what you find when you click on those dots, you'll find an example of the initiative that is there. And it's also linked so that you can click on Babies in Baytown and be brought to that website. The second part of the tool is the Initiative Explorer. And again, I'm not doing this live just to reduce any potential technical difficulties while we are on this webinar, but I did want to show you what this looks like. You can do searches by state. You can filter by the health and well-being focus. You can do a filtering by the service sectors that are represented, by the funding sources, and by the age group. So there really are a variety of ways that you can filter the information. And then when you do that, that will also filter your map for you. So you can click back over to the map and see how your filtered search, what has resulted from that. And of course, you can also see it directly in the screen that in the Initiative Explorer itself that has links to each of these initiatives and provides more detail about them. So we are going to hear, as I mentioned, from initiatives, but I did want to highlight on this slide a few of the key themes from each of the briefs. Now this, as I said, this is really a 30,000-foot view with one key theme. There are multiple themes within each of these briefs, and I hope you'll take a look at them. But we really did learn about the complexity of these initiatives, some of their features, and some of the supports that will be needed to continue supporting these initiatives as they grow and proliferate across the US. Sustainability is a key theme. We learned that the earlier that initiatives plan for sustainability, the better. And that when we have these technical assistance supports, sustainability planning should be one of the first things that is addressed in that technical assistance to ensure that initiatives have the financial support they need to continue operating. We know that for that critical state and local connection, it's really important to establish specific structures, communication, and have relationship building activities to support that work so that it can thrive. There is so much to say about data and measurement, but a key theme about data is that effective data use absolutely requires community engagement and planning and co-design. We heard from multiple initiatives about this vital piece of the work that it has to be done. It has to be done in a co-design fashion. Some of the challenges we heard were that despite the focus on equity in these initiatives and the commitment, the first and foremost, the commitment to equity, there was also still challenges in having a racially diverse staff among the management and leadership positions. And a number of our initiatives mentioned this. So this is a key area for improvement. We saw that the initiatives had supports in place that helped them maintain their focus on health equity. But of course, like many of our work at the community level, there are barriers in ensuring that the work is equitable and that it's able to reach communities and families. So let's end this 30,000-foot overview with some bright spots. Next slide. It's really critical that as we dug into each of these initiatives and the work they're doing, that they are talking about equity both as a goal, but also a process. This is not just an end product that talks about disaggregated data by race, but this is a process for doing the work. We also learned from initiatives about system building work and it's intentional work. It's part of the fabric of the work that's happening. It's not just something that's flying under the radar. This is intentional work. Collaborative partnerships are a key piece of this work, and they were critical during this past year. So they were the engine, they were the way that communities were able to swiftly adjust and pivot to be able to address urgent community needs. Another bright spot is that states and communities are identifying strategies to work together. There is much more work that needs to be done for more initiatives and across more states, but we really did see some bright spots of these places where states and communities are working together. And really finally, a key piece to know is that funders are engaged in conversations with initiatives. They understand the challenges of documenting impact, and we all need to work together to set realistic timelines for how incredibly challenging this cross-sector work is, but how that cross-sector work has such promise for addressing health equity. So with that really brief review of some of our key themes and the bright spots of this work, I'm really delighted to turn it over now to Portia Boddicker-Young, who will provide some background on the initiatives you'll hear about now.
Yeah, thank you, Catherine. I hope everyone can hear me. My name is Portia Boddicker-Young. I'm a research scientist and racial equity manager at Child Trends, and I'm also the co-project director for this project. We were fortunate to be able to continue our work during the heart of the pandemic. And like Catherine mentioned, we spoke to multiple initiatives, networks, and funders about their experiences across topics like data measurement, the impact of COVID-19 pandemic on communities, and how initiatives were embedding equity in their work. So now we're extremely fortunate to be able to be joined by 3 initiatives that we spoke with during our virtual conversations that will each talk about the work that they're doing with their initiatives and their communities. First, we'll talk to Be More for Healthy Babies. That'll walk us through how they're operationalizing equity in their home visiting work. Next, we'll talk to First 1000 Days Sarasota, who will talk about how they've established a coordinated healthcare network that promotes better health outcomes for families. And lastly, we'll talk to Oakland Starting Smart and Strong, who will talk about how they put data into action. Next slide, please. So first, we're joined by Jasmine from Be More for Healthy Babies. Jasmine Covington is Program Director of Home Visiting at Family League of Baltimore and provides programmatic support to the Healthy Families America home visiting programs in Baltimore City. These HFA programs are part of the Be More for Healthy Babies initiative, which seeks to improve birth outcomes and decrease infant mortality in Baltimore. Ms. Covington has been instrumental in leading the BHB anti-racism work group, which was designed to ensure that every family has the opportunity to have a thriving baby and ultimately child despite race, neighborhood, or socioeconomic status. She currently co-leads the city's Baby Stat Coalition, which brings together key home visiting stakeholders to review citywide home visiting indicators and develop strategies for improvement. Ms. Covington earned a Bachelor's of Arts in Psychology from Hampton University and a Master of Public Health degree from the University of Maryland, Baltimore. And she works diligently to ensure that programs and policies that exist within her portfolio are equitable and in the best interest of the families that they serve. Ms. Covington prioritizes thinking critically about the unintended consequences that our actions and personal biases may have on communities and how these consequences may be exacerbated by race. So with that, I'll turn it over to Jasmine.
Thank you, Portia. It's really such a pleasure to be here with you all today. So I'm going to be discussing the ways that we operationalize equity and Be More for Healthy Babies home visiting. So I'll provide an overview of the Be More for Healthy Babies initiative and citywide home visiting, as well as discuss the ways that we ensure home visitor and family feedback are present in our programming. So the Be More for Healthy Babies vision is for all children in Baltimore City to be born healthy and to be able to grow and thrive in healthy families. Next slide, please. We utilize the socio-ecological model of change, which focuses on both external and internal factors that influence the health of the individual. Additionally, we examine the ways that structural racism impacts each one of these domains. Next slide, please. Be More for Healthy Babies, or BHB, is a collective impact model. So we collaborate with over 150 organizations on service delivery, policy, and community outreach. The initiative is led by the Baltimore City Health Department, and Family League and Healthcare Access Maryland serve as co-implementation partners. Next slide, please. BHB is made up of a community advisory board, a steering committee, and a core implementation team. So on the community arm, we have 2 Be More for Healthy Babies communities, which implement programming in neighborhoods that at the inception of Be More for Healthy Babies in 2009 had the highest rates of infant mortality in the city. The core implementation team are really the folks who oversee the day-to-day operations of the initiative. And we also have several coalitions that make up BHB, which include the Prenatal Postpartum Behavioral Health Coalition, Youth Sexual Health, the Early Childhood Advisory Council, the Baby Stat Coalition, which focuses on home visiting, Baby Basics, and the Anti-Racist Working Group. Next slide, please. So our goal is to ensure that all of our services are the best that they can be, not only for our clients, but for our staff as well. We strive to be anti-racist, strengths-based, trauma-informed, and accountable to partners and community. We strive to pursue and provide equitable funding and also to provide high-quality services. Next slide, please. We have 7 priority health areas, which include mental health and stress, nutrition, parenting, safe sleep, sexual health, social emotional development, and substance use. Next slide, please. We take a tiered approach in our programming, with care coordination and home visiting being key components of our work. Next slide, please. So at the health and social systems level, we have a centralized intake system that's operated by Healthcare Access Maryland. Women are referred to the system by their providers through community organizations or through self-referrals. They're then contacted to assess their needs and determine which services they are interested in and eligible for. So the system really provides a central citywide resource database to allow for referrals to appropriate resources. It also really helps to prevent duplication of services in the city and streamlines communication with medical providers. Next slide, please. Our citywide home visiting system uses a mix of evidence-based and promising practice models. So as mentioned earlier, women enter the system through a single point of access via the centralized intake system. We collect a ton of data for home visiting and also participate in continuous quality improvement, which is reviewed at regular collaboration meetings. So it's important to note that different home visiting programs service different areas of the city, but there's also a standardized recruitment messaging for home visiting overall. Next slide, please. As I mentioned earlier, we use a mix of different home visiting models, and at any given time, there are approximately 1,500 home visiting slots in Baltimore City. Next slide. So now we're going to discuss a little bit about equity in home visiting and how we ensure that home visitor and family voice are present in everything that we do. We strive to really make sure that home visiting is a mutually respectful and collaborative relationship for everyone who's involved. Next slide, please. Our home visitors participate in a variety of different meetings and professional development opportunities. So first we have BabyStat that meets monthly and is made up of key home visiting stakeholders like program managers, Maryland state agencies, and community organizations. At BabyStat, we track citywide home visiting indicators, develop strategies for improvement, and also make recommendations for policy and systems change. And this space really provides an opportunity for collaboration to occur across different organizations that are doing maternal and child health work in Baltimore. Next, we have our Healthy Families America, or HFA, home visiting meetings. So this meeting also happens monthly, and it's comprised of HFA home visiting supervisors and managers. It operates really similarly to BabyStat, but also allows us to ensure that sites are operating with fidelity to the HFA model, and also allows us to strategize around issues that are specific to HFA home visiting. In 2016, Be More for Healthy Babies core implementation team participated in our first Undoing Racism training that was facilitated by the People's Institute for Survival and Beyond. So since that time, almost all of our home visitors have been trained in Undoing Racism. And really this allows us all to function with the same anti-racist framework and also to operate with a common language in regards to race and racism. Next slide, please. So as I mentioned earlier, home visiting is extremely data-driven. We strive to ensure that the quantitative data is paired with qualitative data as often as possible. So with quantitative data, we find that it's really easy to look at a number and come to a conclusion that ultimately places the blame or onus on the individual for a outcome. Whereas qualitative data really allows us to dig deeper and identify and address broader, more systemic issues that may be contributing to a health outcome. Additionally, we have quarterly turn the curve conversations with each individual HFA site, where we review a few different indicators and track them over the course of the past year. And then we work collaboratively with the sites to discuss the story behind the data, what's going well, and also to strategize around opportunities for growth and improvement. Next slide, please. So in 2017, we met with 7 different home visiting sites from various models individually to share more about Be More for Healthy Babies equity work, and also to learn about how they themselves were operationalizing equity at their sites. We then hosted 2 equity and home visiting workshops with all of our citywide home visitors in order to identify challenges to equity in home visiting, address strategies for improvement, and also to determine what an equitable home visiting system in Baltimore would look like in a perfect world. So there were 5 common themes that came out of those workshops. They were racism in home visiting models, feelings of a lack of decision-making power on research and policy agendas, racism within the Be More for Healthy Babies initiative as a whole, a lack of resources and services for families, and a lack of resources and support for the home visiting workforce, which was identified as the most important or pressing issue. Next slide, please. So the information that we gained from these equity and home visiting workshops, along with the information gleaned from focus groups with home visiting staff that we did in BabyStat, as well as surveys of home visiting families, are currently driving the development of a citywide home visiting strategy. The vision of the home visiting strategy is to provide high quality prenatal, postpartum, and early childhood home visiting services to support and empower families and to mitigate the impact of health disparities due to structural racism. Ultimately, we'd like to ensure that there's adequate funding to offer services to all families who want them, to provide community-informed services and resources that promote healthy pregnancy, maternal health, child development, psychosocial and economic stability, and lastly, to ensure home visiting staff are well paid, trained, and have a career trajectory. Next slide, please. So that's all I have. I'd be happy to answer any questions that you may have during the question and answer portion. And if you'd like to reach out to me directly, my email address can be found on the slide. It is jcovington@familyleague.org. Thank you.
Thank you so much, Jasmine. Next, we're joined by Dr. Chelsea Arnold from First 1000 Days Sarasota. Dr. Arnold is program coordinator for First 1000 Days Sarasota County. And prior to her current role, she worked as a nurse practitioner, where she saw firsthand the struggles families face navigating services in their community. From her education and experience, she knows how important the early years are for a child's development. Connecting families with resources is key to foster resilience. Her passion is building relationships between organizations to coordinate care, relationships between service providers and their clients to build trust, and relationships of parents with their children to help families thrive. She believes to make a difference, collaboration amongst partner organizations and parents in the community is key. So I'll turn it over to Dr. Arnold.
Hello, everyone. It's such a pleasure to be here with you today. I am looking forward to sharing with you about First 1000 Days Sarasota and learning from others. First 1000 Days Sarasota County was spearheaded by the Charles and Marjorie Barancik Foundation a little over 3 years ago. And what got it started was a staggering statistic that 52% of babies in our county born at our only birthing facility were born into low income or poverty-stricken families. And understanding the significant adversities that these families face from the very beginning, they wanted to make sure that they had the supports to help their children thrive. Since our initial launch of the initiative, we have over 75 partner organizations, and we have 5 key components that are listed over there that are really helping drive our vision. Next slide. I don't need to get into this with all of you on this call, but the first 1000 days are really critical, and we know what happens during those early years really have the potential to impact a child for the rest of their life. And so we really take this as our key driving force to make sure that we're building families up within our community. Next slide. What we found in our community is that we've got a lot of great community-based organizations and nonprofits, but what's really challenging to professionals and parents and families alike was that it was very difficult to navigate the system. We have different nonprofits that are popping up, different grants that come and go, and it's very difficult for families to know where to start, what they qualify for. And if it's a struggle for the, for the families, it's also a struggle for the professionals that are trying to serve them. And so what we're trying to do is take this maze of resources and create a coordinated system of care with the help of a care coordination platform called NICHQ to improve the health and well-being of infants, children, and families in our community. Next slide. Our long-term goals include making sure that all children have an equitable start in life, making sure that pregnant women have all the supports that they need so that ultimately children can be ready for kindergarten, we can reduce those child welfare removals, and really improve our community as a whole. Next slide. As I mentioned before, we have 5 key components that really drive our vision. I'm going to be focusing a lot on our partnerships today because we are a relatively new initiative and we've been focusing on laying the groundwork, and our partnerships have been key, but I'm going to touch on a little bit of these other components as well. Care coordination, as I mentioned, difficulty navigating the system, the biggest barrier. And so we found a social determinants of health platform called UniteUs, which is connecting medical, mental health, and social services all onto one network. What's really nice about this platform is we're able to make sure that families got into the services that they were referred to through a closed loop system. It allows for communication between the different organizations and providers and easy communication with the clients. And then in addition to that, we're able to look at a dashboard to see what services are lacking in our community, what duplicative services are out there, and really build up a way to allocate funds and resources to some of those different lacking services. This has been really key for us. We just implemented it back in September. And another thing that just came out with the UniteUs Care Coordination Platform is a health equity dashboard, where we're really able to look at place-based and race-based disparities in our community and how we can address them. Parent empowerment is another important component of the initiative. We want to make sure that we are building parents up to be their child's first teacher and also community leaders. We have parents that are involved in every aspect of our initiative, even at the highest level, our steering committee. And targeted interventions, as we're laying down this groundwork and identifying what I call a broad approach, addressing those big system barriers, we're going to be looking at a deep approach and making sure we're identifying specific subpopulations or zip codes or certain areas that we need to focus in on in our community. Next slide, please. Integrative activities, we were very fortunate to be a part of the Integrator Learning Lab with Nemours Healthcare System. And in there, they really talked about the key components of the integrator. And I'm going to chat with you a little bit about those today. Next slide. The role of the integrator, there are really 3 key functions: the leadership and partner engagement. This has been really powerful, bringing together key leaders within our community to address big system barriers. Also identifying ways for sustainability of not only the initiative, but also our community organizations and different programs that are having positive results. The last is continuous learning, and I consider this the best part of my job. I love learning from other initiatives, collaborating with different national, state organizations to identify things that we can bring locally to our community. I think it's really valuable and it's important to come up with innovative solutions by learning from others' experiences. Next slide, please. We are using the collective impact model as well. We value using a shared vision and mission it came up within our county. We had many meetings that were facilitated from the very beginning. Buy-in is key. You have to make sure that everyone believes in that mission and vision. Sarasota Memorial Healthcare System is our backbone organization, which provided robust IT support, legal, clinical, and marketing. And it's also really been great for our community because the healthcare system is a trusted source within our community. And so that's really brought a lot of key players and organizations to the table. Next slide, please. We have a steering committee and we rotate different organizations and representatives every year. And this has been really critical to make sure that we have different key voices that are a part of our initiative moving forward. And we also have parents that sit on it as well. You can see in our organizational structure, this is not based on hierarchy. All of these pieces are really key and important to our initiative. Next slide, please. Sarasota Memorial, it's really been, we've been able to use them as that hub for coordination. They helped vet our care coordination platform, and their case managers are using this to connect families after they deliver at the hospital. And so this is really valuable because previously when they would refer people, they would send a fax or provide information to families. But now they're able to use that closed loop system to know that they got the care that they need. Next slide, please. Partner collaboration and innovation, as it was mentioned before in the very beginning, this is really important. And this is the strongest piece of our initiative and will continue to be so. Working together with different partner organizations can reduce misconceptions about different organizations. It can increase communication and also allow you to come up with some really innovative solutions to systemic barriers. Next slide, please. This is from a recent annual partner survey, and this is really valuable information to see because of the initiative, we're building these partnerships, we're creating new programs, and we also are making sure that people's opinions matter and that our professionals feel valued. Next slide, please. We have different ongoing community work groups, our access to care work group, education and outreach work group, and professional development work group. I just want to hit on the professional development work group because this is really something that we're excited about moving forward in the future. Our professional development work group is bringing a county-wide training on trauma-informed care. And then next, we're looking to bring in diversity, equity, and inclusion training to all of our community partners to make sure that when families reach out for help, they're getting that trusted, kind, compassionate care that they deserve. Next slide, please. This is something fun we're doing in the community. We're really harnessing our partnerships within the community and asking them to spread the message about the first 1,000 days. We are having families draw some sidewalk chalk in their front yard and tag us on social media to increase awareness about the services that are available to them through our initiative and our partner organizations. Next slide, please. I just want to end on this because I really feel like relationships are key. In order to instill that positive relationship with the child and a caregiver, we need to make sure that the people that are responding and helping these families are trauma informed, that they are culturally competent, that they are providing that kind and compassionate care that these families deserve. And I also feel as though it's important to make sure that partner organizations are working seamlessly together to address these systemic barriers. And next slide is just thanking our different donors for the initiative. And please feel free to reach out if you have any questions. Thank you.
Thank you so much, Chelsea. Lastly, we're joined by Priya from Oakland Starting Smart and Strong. Priya Jagannathan is the director of Oakland Starting Smart and Strong, an early childhood collaborative. In this role, she builds community engagement and provides support for the overall initiative, individual committees and committee leads, and the leadership team. Priya brings planning expertise, compassion, and an adaptive leadership style. Priya loves to tackle complex challenges by bringing together varying perspectives and sectors, maximizing everyone's talents in the service of a shared goal. She has a strong commitment to the equitable distribution of resources throughout the community and supporting high-quality programs and strategies serving children and families. She currently serves as a member of the following boards: City of Oakland Head Start Advisory Board, City of Alameda Social Services and Human Relations Board, Center for Equity in Early Childhood Education, a child care referral and resource agency. Priya has a master's degree in public health from UC Berkeley and a bachelor's degree from UCLA. She was born in India, raised in New Jersey and California, and has lived in the Bay Area the last 25 years. She feels lucky to be part of the Bay Area community with her partner and 2 daughters who keep her very busy, tired, and happy. So I'll pass it over to Priya.
Great, thank you so much. Thank you for the opportunity to be with you all here today and to talk about our work in Oakland. Next slide, please. So Oakland Starting Smart and Strong is a collective impact table with the goal of making sure that every child in Oakland has access to high quality early learning experiences, and that every adult in that child's life, whether it's a formal educator or an informal caregiver, has the resources that they need to support that child's development. This is a picture of Miss Pitts, who is a teacher at Garfield State Preschool in Oakland, who's now retired. But I just love this picture because it captures the joy that we want all children to experience in early learning environments. Next slide, please. We are in the 6th year of our collaborative, and our collaborative was seeded by a 10-year grant from the David and Lucille Packard Foundation. I just want to state the need and the importance of long-term funding for systems change work. And we're really grateful to have this support from the Packard Foundation. We have brought together key stakeholders in early learning through a collective impact framework, and we've built a structure that includes a lead planning team, a broader task force, and key working committees that all develop work plans that detail shared activities for our collaborative. We've worked really hard to authentically engage early childhood education providers, parent advocacy groups, community-based organizations, funders, systems and local government leaders, and the school district to work together collaboratively to develop, resource, and implement strategies to best serve children 0 to 5 and their families. These pictures that you see here are prior to and during the pandemic. The picture on top is from one of our annual retreats. We've been able to provide a consistent table that meets monthly and connects resources, knowledge, and support, which has been more important than ever during the pandemic crisis. Because of the relationship work that we have done, we were able to adapt swiftly to meet the needs of our community during the pandemic. The bottom picture is a planning team from one of our early learning symposium events that has had over 430 early learning educators participate this year virtually. Next slide, please. So our work is focused on 4 pillar or focus areas. I'll just go over each of them briefly and mention an example or 2 from each one. We are working to improve quality in formal early childhood education, and an example of that is our project called ROC, Resilient Oakland Communities and Kids, where we are working to create trauma-responsive early learning environments. And those activities have included large group trainings, which have been in-person and virtual, monthly professional learning communities, and yoga and mindfulness sessions for early learning providers. We are also working to support informal caregivers, so family, friends, and neighbors who are taking care of young children. And we have been able to seed a 0 to 5 family resource center network that's now housed in a community-based organization. So we were able to raise funding from 5 separate funders to seed this network in our community. We also have been working on healthy development, so scaling developmental screenings, specifically within the school district. And I'm happy to say that they are now implemented in 100% of the Oakland Unified School District's child developmental centers. And they're working very hard to connect children to resources that are needed as identified by these developmental screenings. And then lastly, we are really working hard to improve the early childhood system in Oakland. We have a lot of data in Oakland. We want to make sure that it is actionable and accessible to community. So we've created user-friendly, transparent data dashboards. We've also been working on identifying and scaling promising practices for boys of color. And we're starting to do some upstream policy work to advocate for long-term public investment in early childhood systems. Next slide, please. So we've been talking a lot about equity, and we're working on making our commitment to equity explicit and action-oriented. Over the past 5 years, we've defined equity. We've explored our own personal privilege and positionality, and we've made individual commitments to equity practices in our work. We are very explicit about focusing resources towards children and families who have been most impacted by racial, social, and economic inequity. And some of the ways that we are trying to live our equity principles are intentionally recruiting BIPOC community-based and parent-led organizations and early educators, not just to be collaborative members, but in leadership roles that really shift power. Our Boys of Color work group has been working on identifying 10 promising practices for boys of color using an asset-based framework that nurtures the resilience of families. We've also been working to make sure that we are addressing basic needs. We've been raising money for direct relief for families with young children to be responsive to community need. And then most recently in our policy work, we are really trying to center it around the priorities and experiences of parents, caregivers, and early childhood educators. Next slide, please. So I'm going to talk a little bit about our data in action, how we create and use data in action through a specific example. So we work with Parent Voices Oakland, or PVO, which is a parent-led parent advocacy organization. They interviewed over 600 families in East Oakland in majority Black and brown neighborhoods about their experiences with the child care system. PVO utilized a research justice framework where parents led the research project. In partnership with a researcher from UC Berkeley, parents developed the questions, conducted the interviews, and reviewed the data analysis for themes and recommendations. The study revealed that most families were using family, friends, and neighbors, or unlicensed informal care because they needed non-traditional hours, they had a lack of trust with formal childcare systems because of former experiences and word of mouth, and they had concerns about community safety. Based on these findings, recommendations were developed by parents for early childhood systems and programs. So these findings were used to inform the development of a local ballot measure to increase access to childcare. Measure C in Alameda County was passed in 2020. So this was a half-cent sales tax that raises approximately $150 million a year to increase access to childcare, raise wages, and maintain quality healthcare pediatric facilities. So this was a huge win for our community that was informed directly by the data, experiences, and organizing of community members. Next slide, please. So key learnings and strategies from our data work. Community-centered process. We really need to let parents and families lead the way. So we provided funding support and the platform to amplify the work, but we did not direct or lead the research process in any way, including the recommendations. Analyze who is and who isn't at the table. So for example, childcare educators were not involved the first time the measure was put on the ballot, and it wasn't successful. They were included the second round, which made a huge difference. We also want to make sure that we're using community-led data to challenge assumptions. So prior to the study that I mentioned, there were many conversations about why families weren't using childcare, but no one had directly asked the families. We want to make sure that we're framing the data to make sure we are assessing structural issues versus assigning individual blame. For example, instead of asking whether young children are ready for kindergarten, we should be asking, are our schools and communities ready for kids? And then of course, we want to connect parent engagement to resource allocation and responsive programming, not simply just to say you did it. Next slide, please. So our policy agenda, we recently received funding from the Hellman Foundation to expand our work into the policy and advocacy arena. We've been working to co-create our policy agenda, building upon our projects on the ground and leveraging the different voices and relationships we've built. So we are grounded in equity areas of systems change, parent and family leadership, and workforce equity. Some examples of our policy in action are, we've been doing advocacy with our local legislators. So informing them how proposed legislation will translate to the ground and actually impact children, families, and providers. We've met as a collaborative with legislators, bringing family childcare providers and parent advocates along with systems leaders to really provide a comprehensive, informed perspective to our elected officials. They've really appreciated hearing directly from providers and families. We are also, another example is our family childcare policy platform. Many family childcare providers have been working throughout the pandemic, caring for the children of essential workers. Their needs and experiences have been missing from many policy conversations. So we have convened, along with local partners, a planning committee of family childcare providers that's holding listening sessions and developing a platform of priorities that will eventually be presented to our elected officials by the providers. And with that, I will conclude my presentation. Thank you so much for the opportunity to share some of our work today. I'm really looking forward to continued dialogue and growth in our approaches to best serve children and families.
Thank you, Priya. And with that, I'm going to turn it over to Jen, who's going to open it up for our discussion and Q&A section.
Thanks, Portia. So there's a set of questions that have come in just so that everybody's aware of it, and through the Q&A that's at the bottom of your screen, and our presenters have been kind enough to actually go in and answer many of them. But I'm actually going to pull back and ask I've been working too much with providers, our presenters to answer some of them on the discussion so folks can hear. So I'm actually going to start with a question that was raised for Jasmine around what sorts of issues. You talked a lot and very eloquently about anti-racism in your work, and what sorts of racism you identified and addressed throughout your work.
Yes, so I think home visiting in general, although voluntary, can often be very paternalistic. So do things this way. The information we're giving to you is the correct information, and what works best for you and your family doesn't always matter. So that was one of the big things that home visitors identified as far as racism in the models. They also identified that leadership for the models is usually made up of white women, in that the materials that sites receive usually features mostly white families. And lastly, we talked a lot about the data that is collected and the way that it is presented and analyzed.
Thank you. For Chelsea, I know you're in the middle of typing an answer, and I'm actually going to ask you to talk it out loud about the coordination and referral platforms and issues in having your providers not have to provide updates in multiple resource directories. I know a lot of initiatives are thinking about coordinating referral. So would you mind sharing your answer to that?
Sure. Yeah, so when we started the initiative, again, the biggest barrier was that difficulty navigating the system, and all of these different referral systems were already in place in our community, and they just weren't working for what we needed. And so we were trying to find something that provided more, and we needed that closed loop system, meaning we needed to know whether people got that connection or not. Just providing a referral or providing information that doesn't really let us know whether there's gaps to care or barriers in our community. And so we needed to have something else. We are working through ways to make sure that this is not as complicated. We know there are certain requirements, certain state requirements, national requirements, such as housing requirements. But for us, we chose a system because what was in place was not working. And we want to make sure that we're not adding additional work, but we also found that a lot of people are using fax machines. That was still the top referral, or handing people a piece of paper. And so we brought in something that would be able to reduce that amount of time people spend at the fax machine. I would say maybe 50% of our organizations were still using faxes. So they weren't using the systems that were there because either they didn't work, or they were challenging, or they didn't see the value. So that's why we brought in a different system, and people have been really happy with this, and especially that closed loop system and knowing people got in. When you think about burnout and compassion fatigue, knowing that the family you referred is in for a service when they are going through a very traumatic event is really valuable.
Thank you. And that answers a question that just came in about whether you track children's referrals to different agencies, and yes, you do. That's really remarkable. So I'm going to turn a question to Priya, and then I'm going to ask a question of all three of you. So Priya, I wondered if you would speak a little bit about whether you had to do some prep work for engaging engaging parents more in the work, both for partners who sometimes don't come at that approach respectfully, and also for the parents themselves and what that looked like.
Sure. You know, when I came into our collaborative, it didn't really look like the community. And so that took a lot of work and very intentional conversations with folks about how we would make sure we would do work differently. And, you know, at first, there was a lot of conversations about like, oh, how do we get parents to come to these meetings that we're holding during the day? And we quickly moved to not having that approach and really going to our local community organizations that have powerful parent organizers and coming to them and saying what could be a value add. And what we found was a lot of parents wanted to be connected to the school district. They wanted access to, you know, how decisions were being made, and that was something that we could support with in making those connections between systems and policymakers and making the space and actually preparing not necessarily the parents, but the systems folks and the school districts folks to actually really be open to what parents and families were saying. You know, for example, during the study with the Parent Voices organization, there was a lot of issues around racism in the enrollment process. And so what we were able to do is convene providers specifically around enrollment practices and say, this is what parents are saying, and to bring folks together around a very specific issue and problem solve together. And so that's an example I would give.
Thank you. That puts some meat on the bones too. Can you say anything about what the issues of racism in the enrollment process that you heard were?
Well, a lot of it was about how the questions families were asked when they came to sites. We heard a lot also from, you know, our Black fathers about just assumptions that were being made and the questions that were and were not being asked. And so there's also a very cumbersome enrollment process in some of our systems, and folks would have to you know, submit multiple applications, provide some proof, lots of proof of different things that weren't necessary. And so trying to tease out like, okay, how much of that is because of regulations, things that you're required to do? How much of it is because of assumptions you're making about what families can and can't do? And how can we make this a process that's more transparent and accessible to families?
Great. Thank you so much. And thank you to all three of you, both for the work that you're doing and for these incredible presentations. We're just about at the hour. I'm going to turn it over to Kristen Klacke to wrap it up.
All right. Thank you all. Thanks to all of our presenters. It's always great to hear about your great work going on in the community. And we just wanted to let you know, I think that the Child Trends link of where these products are posted has been put up in the chat box. And then we're also going to be sharing specific links of where to go to find these in the coming days and weeks on our websites. And that'll be with a follow-up email with all of the slides and everything else. So thank you all so much for joining today, and have a great rest of your day.